If you feel tired or get sick way too often, there's a simple test that could really change your life, but not all the doctors know about it.
4 out of every 10 people are living with a gene deficiency that leads to illness and other problems. This test can identify that, but it can also reveal how your body reacts to a long list of popular prescription drugs to help you avoid a dangerous reaction. Our Nikki Kimbleton took the tell-all test. Just as her results are giving her answers after a lifetime of health issues, the test can also help you.
It's the 4th leading cause of death, beating out car accidents, even diabetes. Each year, over 2 million people have adverse reactions to prescription drugs. It's way too common, especially because it can be avoided.
We do medicine, unfortunately. It's called trial and error. Nobody will tell you that, but that's exactly what happens.
Pharmacist Todd Troxell's seen far too many patients get sick while taking medicine to get healthy.
If you ask your physician whether or not this medicine they give you is going to work or not work, they cannot tell you that. Cannot tell you that.
Not unless you do this.
And we're going to set a timer. So that's going to be 45 seconds, swirl, rotate it around.
A simple test that I decided to take, a cheek swab that reveals information about your genes and how you react to hundreds of medicines. We had the results back in just 2 weeks.
Are there any big red flags of things that I just should not be taking?
You had to be careful with some of the antidepressants. You actually were a rapid metabolizer for some of these meds, so you would need to take even a higher dose than a normal dose that somebody would give you.
The way the results are listed, it shows you what you shouldn't take and why, when you should proceed with caution, and what you can take as normal. While I had red flags in several categories, another that caught my attention was Plavix. It's a well-known blood thinner typically given to heart patients, but the way I react to this medicine...
So the potential is you could bleed instead of it being most effective as being an antiplatelet product.
That's a scary, possibly deadly situation because without this test, I might not have known it until it was too late.
Do you think this can vastly reduce the number of reactions that we're seeing?
Yes. In a word, yes, it can.
Michael Shue is a pharmacist at Mayo Clinic in Jacksonville. He expects that soon every Mayo Clinic patient will take a test like this one.
We're working in that direction right now.
Do you feel like this test could save lives?
I think in some instances, yes.
And it's not just because these tests stop you from taking the wrong drugs. They can uncover so much more about your genes and your body. And that's where we go back to my results. Turns out this revealed something I never expected. I've been living with a very common gene deficiency and never knew it.
I get sick so easy. I mean, I'm always sick and I'm always tired. And you found out the reason for that.
You came as an MTHFR deficient individual.
MTHFR, never heard of it? Well, me either, but how I wish I would have known way before now.
The MTHFR gene is a big deal, primarily because it's involved in a process called methylation, which relates to almost every part of the human body.
Basically, my body can't dump toxins like it's supposed to, so they get in my bloodstream. Plus, I'm not able to get enough of some crucial vitamins. So the end result, it's really hard for me to stay healthy.
You can have 2 people in a room, and a virus enters it, and one person gets sick and the other doesn't.
The one who gets sick, you guessed it, would be MTHFR deficient. And I'm not just at risk for the common cold. Dr. John Rapoli at Jacksonville Health and Wellness Center says without treatment, this can lead to cancer, Alzheimer's, cardiovascular disease, and more. And what's really scary, almost half of you watching have this deficiency. The upside?
It's an easy fix. And so for MTHFR, it's the cliche that we've always heard, eat your fruits and vegetables, but we kind of bring it into a different realm, eat your vegetables, and specifically green leafy vegetables. If you do that every day, you have an added protection, even if you are carrying the mutation for that MTHFR gene.
And the earlier you know, the better. That's why Dr. Rapoli encourages people to get tested.
And digging one extra layer deeper can uncover a very simple problem that can be fixed almost instantaneously.
And again, that is because, like I said, most can fix this deficiency easily with diet and with supplements. In fact, that is why some area pediatricians are giving this test to all the kids that come in as patients so they can identify and address this very early on. By the way, for anybody who wants to get the test, I took the one that's called the Right Test. I took it through Trox Pharmacy. It's $399, but it tests for all the different medications as well as for MTHFR. Other pharmacogenetic tests don't test for MTHFR, but you can get a specific test for it that usually costs less than $100. Nikki Kimbleton, Channel 4, the local station.
For links to where you can take the tests, go right now to news4jax.com. You'll also find how UF Health is using gene testing for their heart patients, saving more lives. You'll find the tell-all test on the homepage of news4jax.com.